shall we go straight into our topics? Right, I think that's a great idea because it is a busy studio. Okay, we're talking about cervical screening and everyone has their own expertise and maybe we all have our own experiences as well. So first of all, welcome both of you. Can I ask you to introduce yourselves? Let's start with the doctor.
Thank you so much. So, hi everybody, I'm Dr Glenda Beard. I'm a GP at the White Ladies Medical Group in Bristol and really thrilled to be here today to talk about cervical screening, which is such an important topic.
You're very welcome.
Hi there, my name is Huda. I'm from Caafi Health, a community organisation, and equally really happy to be here to talk about the cervical screening as well and cervical health.
Excellent, thank you. So, cervical screening. So, I spoke to the Real Women about this, and there are lots of terms that we use for cervical screening, but when I hear that term, I always think of Jade Goody, who sadly passed away some years ago now, at least 10 years ago. She was a TV presenter and a very well-known personality. And she brought cervical screening, I think, to the fore for thousands of women, because for me, even when I hear her name or when I hear cervical screening, I think of her. I have to just start by asking, Doctor, what is it? What are we talking about? When we say cervical screening, what does that mean?
So cervical screening is one of the NHS screening programmes. A really key thing to know about cervical screening is it is a screening test that's looking for changes that are before cancer develops, so it actually prevents cervical cancer. So that's really important for people to know if they're feeling fearful about it. The basic cervical screening test is attending a practice, normally with a practice nurse who's very experienced in taking cervical screening samples. And they use a soft brush to take some cells from the cervix. The cervix is the neck of the womb. And then that gets sent off to the laboratory and it gets tested. And the results will come to you in the post.
Well, the next question has to be, and it's going to sound like a really silly question, but why is it important for women?
So there are no silly questions, to be really clear. It is so important for women. And when we say women, I really want to highlight we're talking about all people who have a cervix. So that may be a trans man, it might be someone who's gender non-binary. So we're grouping all of those people together because if you have a cervix, you're entitled to cervical screening. And it is so important because cervical cancer is a preventable cancer. So by having this test, by picking up those changes, we know we can treat them and we can stop people getting cervical cancer, which means we can save people's fertility, means we can save people's lives.
Right, wow. So I want to move on to Huda now because you're here from Caafi Health. Can you just tell us what is Caafi Health and what does it mean to women out there?
Well, Caafi Health is a community organisation, as I said. We're based here in Bristol, but we do work across BNSSG, so that's Bristol, North Somerset and South Gloucestershire. And what we do is we support people into understanding their health better. So, for example, women, we support them in understanding how important it is to have the cervical screening done and answer some questions that they may have. So these are maybe women that may not speak English, so therefore we support them in their first language. It may be some cultural elements where some people may feel that perhaps due to privacy, due to lack of maybe an understanding around the cervix and why women need to have those cervical screenings. So we're kind of like a supportive organisation that support people to understand things like cervical screening amongst other services.
Right. So you mentioned culture. So when it comes to culture, I want to ask, do some women from some cultures find it difficult to accept that screening is important for them, or sometimes do they ignore it?
So, cultural and social factor plays a huge role in whether people attend cervical screening, And in some communities, discussion about reproductive health are considered a taboo. And so making it difficult for those individuals to seek information or support. Sometimes religious belief, as I said earlier on, privacy concerns and also some negative experience with healthcare providers can also impact participation. So things like misinformation and fear of whether people have pain or about the procedure itself or potential stigma. These all discourage uptake. And so therefore, especially for women from the ethnic minority community, a lack of trust in the healthcare system. And also that itself can affect the engagement for the preventative services like screening. And then I guess of some other women, for example, if they're survivors of female genital mutilation, for example, cervical screening can be particularly distressing. And so many avoid it due to past trauma. Yeah. And I think a fear of judgment or lack of understanding from a professional. And these are crucial for screening services to be more trauma-informed and sensitive. And I think that's where we come in and support people with those elements.
Absolutely. And can you talk a little bit more about how you can actually change women's minds? Because your service is so important, and what you've said is vital. How can you change someone's mind from, no, I'm not doing this, to actually, this is really important for my health and my life?
I think it's just listening to those women's concern and unpicking those concerns that they have. It might be someone really is just concerned about pain, or it could be some maybe a discussion they had with a friend, and that friend experienced pain, and so therefore the fear that they may experience the same thing. Yeah. So it's just about really listening and understanding why those concerns are, and then empowering them to kind of make the decision to have this screening. It's all about, majority of the time, like I said, it's misinformation. It's information people have heard. It could be a simple thing like, I'm a woman who I want a woman to do the procedure and not a man. And there might be concerns about who's actually performing the procedure. So it's just, when you listen to those women, you understand better what their concerns is, and then you can address it.
Mm-hmm. Doctor?
Excuse me, I was going to come in to say it's so important, that listening, isn't it? And then actually empowering those individuals to be able to say, actually, I do want to have this done, but I want a female member of staff to take that screening test for me, or to recognise the challenges that other people might have experienced in the past, because there are things that we can do to help to support people. So if someone says, actually, I'm really worried, I think I need a longer appointment, I want to bring a friend with me, I want to listen to music, I want to listen to a relaxation exercise, some meditation while I'm having this done. Those are all things we can support in primary care. And so it's really important to listen, to understand why people aren't coming forward, and to empower them to have those conversations. Our nurses and practices will really happily talk to people before their appointment.
I just want to talk about language, because we're early on in the conversation, and the language that we use. So we're talking about cervical screening. We did used to say smear tests, didn't we?
We did. And the language has changed, because the word smear is not a nice word. I don't think anybody receives a letter inviting them for cervical screening and goes, whoop, that sounds great. But the word smear, it's not great. So we've moved away from the word smear to the word cervical screening. In the States, it still gets called a pap smear. So people sometimes still use that, and they're thinking, I still don't know what this is, this cervical screening test, but absolutely moving away from the word smear.
I think that's really important about the language. We were discussing this before the show, because if you receive something that has this negative connotations of like this, the word smear, then it sort of sets alarm bells off. Whereas, I've had notifications before now, and I'm like, okay, here we go. I've got to have this. And I really feel that if it was highlighted that this is preventing something, you're doing something for your well-being. And it is a very private and personal experience, and you're going for that procedure, but you actually have the option to do something that's good for you. And I think we were saying again before the show that it's a way of looking after yourself and discovering something very early on. And how often do we get that chance?
I was going to say that a lot of the time we see women saying that they feel fine, so I have the test, and that's the biggest thing we see, because I think is that not understanding what having the cervical screening is going to do for you. So if you feel generally fine, then you think, I don't need something. And so it's just kind of making that woman understand, you feel fine, but this is a way to detect something that you don't know, that you may not have no symptoms for.
Yeah, I actually received a letter myself a few days ago to come in for my cervical screening, and I was like, oh goodness, it doesn't seem like that long ago that I've had that. Is it every 3 years, or is it dependent on age? Or what's the current sort of programme?
So you get your first invite in the months before your 25th birthday, and then it's every 3 years until the age of 49, and then every 5 years from the age of 50 through to 64. Having said that, if you are over the age of 64 and you haven't had a cervical screening in that 5 years leading up to being 64, you can still have one then. But otherwise, after the age of 64, that invite ceases.
I think it's absolutely amazing that, we are moving, hopefully, more towards preventative measures, and that a test like this, whilst it is very intimate, anytime I've had it done lots of times, and it's always over really quickly. It often surprises me that it just is very quick and easy, actually. And I'm like, oh, is that it? Okay, yeah.
You're right. It normally only takes a few minutes. I do want to acknowledge sometimes people who have found it really difficult feel a little bit dismissed when we say, it's really straightforward, it's not uncomfortable, and people go, well, that wasn't my experience. So for the vast majority of people, it is. It is a little bit like, that's great, but it's over and it's done within minutes. For some people where it has been difficult, I just really want to reassure those individuals that there are things we can do to help them for that test to be much more straightforward, much more comfortable. Even simple things like being in a different position. So the normal position people would have for cervical screening is lying on their back with their legs apart, but you can in fact have cervical screening lying on your side. And for people who've got back problems or sort of really don't like feeling as exposed as they do lying on their back, that sort of side position can be really helpful for those people to be able to get through that procedure.
And is it, just one more question, you said about asking for more time if you're someone that's either particularly nervous or if you've had a previous bad experience and that makes you feel in some way related to healthcare or something that's happened to you that makes you feel scared, you can have someone with you. And you can also have a longer appointment. Is that right?
Yeah. So when you book your appointment and speak to the receptionist at your practice, you can say, I'm really worried about this and I'd really like to have a longer appointment. Or alternatively, sometimes people will go in for an appointment just to talk to the practice nurse in advance. One of the things we use to do a cervical screening test is something called a speculum, which is sort of a little plastic instrument that gets inserted inside the vagina and is opened up gently to see the cervix. And sometimes people will take that home and actually try themselves at home or insert it themselves to have their cervical screening so they feel more in control of what's happening.
Can I just say, one of my friends got into such a state about just going to the surgery, and she was saying, we're going to have to explain that I'm going for this procedure. And we were talking earlier, and it's like, you don't need to tell everybody if it is something that you might not wish to share with the rest of the surgery. So you can just say, I'm here for my appointment. You don't have to, you can make it your own and you can go along and you don't need to share it with everybody, but it's just so important to do it, isn't it?
It is so important to do it. I think when you book the appointment at the practice, you obviously need to say what the nurse appointment is for, so you end up with the right person to do it. And obviously you can do that over the phone, and lots of practices now have online booking as well to make it easier to do that. But when you attend the practice and you check in a busy waiting room with a queue of people behind you, you can just say, I'm here for my appointment with the nurse. No one's going to be questioning, what? Announcing, for your cervical screening test. Great, well done.
Yes, yippee, you're
Take
here.
a seat. You might want to empty your bladder first.
Thank you for the reassurance.
These are really good points. And as I'm listening to this conversation, I'm thinking to myself, for me, and I'm sure there are a lot of women out there who may feel the same thing, the anxiousness, the thought of, you have your appointment, you've got to go, and today's the day. And that feeling of, I really don't want to do this. I actually don't want to do it. And I'm feeling a bit shivery right now because my letter is waiting at home as well. It's on my desk and I haven't done anything about it yet. Now, I know I have to, so I'm not going to be ignorant. I know it's something that I have to do, and I will. Of course I will. But even now, during this conversation, I'm feeling quite anxious. I know I'm not looking forward to it, and actually, I don't want to do it, even though, like I said, I have to. Am I alone?
You're not alone, and we know that there are so many people who put off that appointment. So we know about a third of people don't attend for their cervical screening. And
a third.
So it's a lot of people.
Of women.
It's a lot. Yeah. And I think that, as you say, that sort of embarrassment, that fear, all of those things contribute to that. Huda and Caafi Health have done some great work speaking to women around Bristol to really address those fears and concerns and say, do you know what, the nurses don't care if you haven't shaved your legs. They don't care about the state of your pubic hair. You may have no pubic hair, you may dye your pubic hair. It's fine. It's just pubic hair. We are healthcare professionals who are doing this, and we are there to enable people and support people to have that cervical screening test done. And so I just really want to reassure people that it is in their best interest to do that.
I'm glad you've brought that up. So, Huda, in your sessions, what kind of things do women say to you? I mean, what are the questions that women bring up when you talk to them about this?
it's the same thing that I thought about when I was having my cervical screening. the embarrassment. I don't want to go. The speculum's too big. I don't want to sit there. I'm exposed. This, embarrassment being the biggest thing, pain being the second thing. Will I be judged being the third thing? I just don't like, it's private area. But we all have those. I think, in all honesty, I think every woman probably have some of those experience, and we just have open conversation about it. We laugh about it, joke about it, say, I've had the same experience. And, and then women feel a lot easier that they're not alone. That's not an experience that they're feeling or fear that they're having alone. But by just having that open conversation and say, yeah, I completely understand how you feel. I felt exactly the same way. And like you said just now, just thinking about having your cervical screening, you're like, oh my God, I have to go through that. But it's an internal thing, I think. And once you're there, the other thing I say is that actually the nurse don't care. She's done this so many times. It's just doing it, It's like no one's judging, no one's looking, like you said, no one's taking an interest in what you're wearing. People sometimes tell me I have to try and get really good knickers. No one really,
no one cares.
The other nurse that's doing that doesn't care what knickers you're wearing, whether it's granny pants or G-string or whatever it is. No one actually cares.
I love this conversation, honestly.
Absolutely brilliant, isn't it? On a Tuesday morning to be able to be so honest and positive and have this conversation that will hopefully change some people's minds.
We just tell them you can go with your Bridget Jones look or you could go in another look. It doesn't really matter. And then that laughing and that just general humour, normal conversation makes it easier. And they're like, you know what, that's fine.
One thing I would say that often helps lots of people who are coming for their cervical screenings to wear a skirt, because actually if you've just got your skirt on and slip your knickers off underneath and pop, you just feel more covered. And although when you're there are curtains in the rooms have doors that are shut, everyone is doing as much as they can to maintain your privacy, and if you don't wear a skirt, it's fine. You'll be given a lovely bit of couch towel paper to go over you, but actually just wearing a skirt can help people to just feel that bit less exposed.
I just want to ask about the appointment time. When you go to the doctors and you think, right, I've got 5 minutes or 7 minutes to explain exactly what's wrong with me, and then and then the time's over, you have to go. And it's kind of impersonal. And I'm not saying that all doctors' surgeries are like that, but I'm just giving that impression that you've got this amount of time. When you go for your screening, is that the impression as well? Or can you have a little chat, just to be able to relax the person, to make them feel better about the procedure? And, do you have to feel like my 5 minutes is over, get out?
So cervical screening appointments are normally a little bit longer than your sort of standard GP appointment. So the nurses will normally have 15 to 20 minutes for that appointment. In fact, when I last went for my cervical screening, I started getting undressed the second I got in the room and was told to put my clothes back on because she needed to ask me some questions first. So there is a little bit more time. And absolutely, that conversation and that humour is so important to us as humans. We want to connect. We want people to feel reassured and feel safe where they are. So I would hope that people, when they're going for this, don't feel unduly rushed, as I appreciate people often do in GP appointments where we're trying to gather a lot of information in quite a short period of time.
For women who do not speak English, sometimes they're given an hour appointment as well, just so that if they need to have a translation there. Fantastic. To kind of support them. So there's that extra hour as well, just to go over the language barrier.
I was just thinking about how I feel like my own experience of using services recently in Bristol, Women's Health Services, which was for treatment a little bit more than a cervical smear, and quite intimate as well, an examination of the womb. And I was honestly really impressed. And I think there's just more and more emphasis these days on making sure that women are comfortable and informed and that they're giving consent as they go. And and also, there was even a little light show on the ceiling of the clinic that I was in. So I was able to put my attention onto the lights to take my mind off the very slight sort of, wasn't even uncomfortable, but for this procedure there was a little tiny bit of discomfort at one point. And I also am a trained hypnotherapist, so I've got self-hypnosis. So I use self-hypnosis, which is basically just relaxing and sort of slightly distracting your mind. But I love things I was so impressed, that there was this light show on the ceiling to help me to focus on that and take my mind off any sort of slight physical discomfort. So I just think we're doing more and more to make health services better for women and everyone. And I think that's absolutely fantastic. So amazing work that you're both doing.
BCfm and Real Women, talking with Dr Glenda Beard and Huda Hajinur from Caafi Health. Fascinating conversation, women. Just before we went to the break, Huda, you were talking about men and men's involvement, and they're playing their part in this by encouraging women maybe to go for their test.
Yes, no, that's right. So one of the concerns we see and what we see on the community is that a lot of women don't have the time, or they don't prioritise their health. You know, they're often got kids to take to school, they go to work, and time is very limited. And they see cervical screening possibly because it's not something that's physically wrong with them and is a preventative. It's something that they could put at the back of their head. But I think if we could encourage men to understand the importance of cervical screening, that can help break down barriers, and men can play key roles. For example, they could support their partner or sister or mother or any, a friend in attending an appointment. They can support with encouraging women to have the conversation in the household around how important it is, So a man could, for example, my husband could say, "Oh, I saw your cervical screening. Are you going? Do you need me to take the children for you, or shall I make the appointment?" Or they could have that discussion. Yeah. And I think if men, the whole screening is focused on the woman, and we put the whole pressure on the woman, but actually, no man wants to see his daughter, his mother, or his wife not go for a screening and then sadly die of cancer because it wasn't picked up early. I think if they knew the importance of a screening, they would definitely support their women. But I think the emphasis is not there. It's constantly emphasis just on the woman. But I think there should be more emphasis on men as well to support women in getting their screening.
And Karen, thank you, Huda. Karen, what were you saying about you were talking about the percentage of women who it's usually negative. Was that what you were saying in the break?
I suppose I was asking that of Glenda, that, maybe the thought of something being picked up could be off-putting to some people, like could create fear. But actually, the whole point is we're picking up something early that is often very treatable, that if it isn't picked up or it isn't treated could become a much bigger problem. So it's that prevention. Probably it will be negative, you said, Glenda, most of the time, but...
Yeah, so most of the time cervical screening is negative. That doesn't mean don't go because you think it's going to be negative, but most of the time it will be, and it will be a test that you can tick off your list, be reassured, and wait for your next 3 to 5 years for your next screening. But for those times where it is a positive test and you're invited for further investigation, it's so important because of that prevention aspect. We're not screening to try and pick up cancer, we're trying to pick up pre-cancerous changes that can be treated really normally in a very straightforward way and stop that cancer ever developing.
We have a message or a question from someone. Should you bring, for example, panty liners with you? Would there be any bleeding, for example?
So occasionally people can get a little bit of spotting after having had a cervical screening. The brush that is used to take the cells from the cervix is a really soft plastic brush. You can have a look at them if you go for your appointment and see the practice nurse and have a feel of them.
We were allowed to do that? Go and ask?
Yeah,
you
can ask.
Great.
You can see the brush. But obviously the cervix, everyone knows that sometimes you can get a bit of bleeding after sex and things like that. If you do, I want to know about it. Please come and see me. But the cervix is a vascular part of our bodies. There's lots of blood vessels close to the surface. So if something's brushed across it, then you may get a little bit of spotting, and that would be sort of expected in that scenario as long as it settles down quickly.
I think that's so reassuring because sometimes I have quite a vivid imagination. So if I'm lying there thinking, oh my goodness, what's this brush, but if I saw it beforehand and, could touch and think, okay, so again, it's reassurance, isn't it? And it's because as soon as you start getting stressed or scared, it's much more difficult to relax for the procedure. So it's this sort of vicious cycle that we're in. So anything that can dispel that fear, I always sort of look at it, because it's not my favourite thing to do, but I'm actually looking after myself and giving myself the best option if there is something wrong. So I have to do it. I've got no choice. I want to be, around for a long time, and, let's get on with it and get it done. And then I actually usually treat myself to something afterwards, which I know sounds like a bit silly, but it helps
like
me.
Chocolate or something.
Oh,
that's nice.
Yeah, exactly.
Yeah.
There you go.
I like that. I do like that. We're coming towards the end of the conversation now, but I don't think we could end without talking about the vaccination, the HPV vaccination, which Doctor, you're going to talk about?
I'm going to talk about the HPV vaccination, which is just amazing. You know, if you said, there's this vaccine you can have which can prevent cervical cancer, and although we're focused on cervical screening and cervical cancer now, I also want to flag that it also significantly reduces the risk of some head and neck cancers, penile cancer, anal cancer. So it is an amazing vaccine, and it is offered for free on the NHS to children in year 8 at school. You can, if you've not had it, catch up with that vaccine up until the age of 25. And for men who are having sex with men, actually that vaccination continues for a bit longer, and that's accessible through sexual health clinics. But it is an amazing vaccine. We know most cervical cancer is caused by HPV, which is the human papillomavirus. So there's over 100 types of this virus. Some of them cause genital warts. So the vaccine also protects against some of those, which is great. Nobody particularly wants to get genital warts either. And by having this vaccine, we know it can prevent almost 90% of cervical cancer. It doesn't prevent it all. Okay, so there are over 100 types of HPV. It protects against 9, so people can still get cervical cancer, but that rate is dramatically reduced. So key messages for listeners really are the importance of having this, important of men, you know, engaging with this, supporting their sons and daughters to get the vaccine, because it also protects against those other cancers that I mentioned in boys. Also then really remembering that just because you've had it, it doesn't mean you don't need cervical screening. You do still need to attend, and by that vaccine, by cervical screening, and by treating those early changes, the NHS has set a target of eliminating cervical cancer by 2040. There's no other cancer that we're talking about like that. But cervical cancer, 2040, we hope to eliminate it through those things.
I heard that.
That's incredible.
It really is. Well, we've virtually got to the end of our conversation, but if anybody wanted to find out more, who do they go to? Who could they call? Is there a number?
Well, we offer, we've got, for the HPV vaccine in particular, we've got health ambassadors and can come and support people they can talk to and ask information.
So you could go into schools and that kind of thing?
Well, we go to community settings. Our wellbeing clinic at Barrack Mall on Stapleton Road, there's lots of information people can take away in different languages around the HPV vaccine, around cervical screening, and there's people there that I could talk to on a Tuesday and every Friday.
And whereabouts is that, Huda?
It's on Stapleton Road, opposite the leisure centre, and it's called Barrack Mall.
So Sirona, our sort of community health provider, provide the vaccination in schools, and they provide lots of catch-up clinics as well. So if people go to the Sirona website, there's a phone number on there, and you can ring that number to get booked into catch-up clinics or book your children in. Once people have left school, they can book that HPV vaccination in primary care. But from a cervical screening perspective, there's so much information out there on the NHS website. There used to be an amazing charity called Joe's Trust, which sadly closed. But the Eve Appeal has lots of information around cervical screening, as does Macmillan. So there are lots of resources out there. And coming back to that, you know, Caafi Health do an amazing job talking to people about their health, and our practice nurses and clinicians at the practice are also really keen to support people to attend.
Well, it's been a pleasure to talk to you both today, Dr Glenda Beard and Huda Hajinur from Caafi Health. Thank you so much.